Spend few minutes, learn or revise medical facts. This is a receptor-based assumption about how beta blockers cause glycemic alterations. Beta cells of pancreas has alpha and beta sympathetic receptors. Epinephrine or adrenaline binding to alpha receptors reduces insulin production, and that of beta receptors increases insulin production, leading to reduced glucose production. So, when the patient is administered with beta blockers, it reduces insulin, increases glucose, finally causing hyperglycemia. But in most of the cases, beta blockers cause hypoglycemia. Why? This is because insulin production is not the only action of beta receptors. Beta receptors present in the liver helps in glycogenolysis and gluconeogenesis, thus increasing glucose production. So, when beta blockers are administered, it inhibits both glycogenolysis and gluconeogenesis, resulting in reduced glucose, finally causing hypoglycemia. Beta blocker induced glycemic alterations are mainly seen with diabetic patients. That is, healthy individuals are rarely at risk of causing beta blocker induced glycemic alterations. Beta blockers mask hypoglycemic symptoms. How? Most common symptoms of hypoglycemia are tremor, tachycardia, palpitation, and sweating or diaphoresis. These all are sympathetic stimulations. And beta blockers are sympatholytic drugs which suppress these sympathetic stimulations, except sweating. Sweating is not affected by beta blockers because even though sweating is a sympathetic stimulation, sweating happens when acetylcholine binds with muscarinic receptors. So, beta receptors are nowhere in coming in action during sweating. As beta blockers mask hypoglycemic symptoms, regular monitoring of blood glucose is required as the patient won't be aware he or she is undergoing a hypoglycemic condition unless and until blood glucose level is checked. Subscribe and learn or revise medical facts.